of the ancillary drugs. The TB drugs are supported by Global Fund, but to treat these side effects, we need ancillary drugs, and it is on the shoulder of PIH to support this. Patient nutrition is also another area of support. We make sure that our patients are feeding because they are swallowing more than, there are patients who swallow more than 10 tablets a day. So if that person doesn't have a food, it is difficult to ask him to drink 10 tablets a day. So we are making sure that our patients are eating, and at the same time our patients are taking their medicine. Psychosocial support is also another area of our intervention. This support is so broad, so I hope you may know about this, and if you need a clarification, I will explain it later. But we have a package under psychosocial support. It might be acute need, depending on patient interaction. We just give them acute need support. It might be like if the patient have nothing to wear, we just provide him a clothes. If the patient have some family issues, some payment, we provide, and some like acute, as the name indicates, in acute intervention. Another psychosocial support is livelihood support. Those patients like Henry, a student, we know that he's going to school, paying a lot of amount of money, even after completing his TB treatment. So we continue supporting them for them to complete their education and to make them to be in the right place, in the right position. So this is a long-term project. It's not like a 1 month, a one-day project. It's 2 years, 3 years, maybe 5 years, 10-year project. So there are a lot of patients that are benefiting from this service as well. So we also provide a package depending upon the discharge when we discharge them on ambulatory care. And also we provide them some amount of money, a cash payment, for them to pay their transport to come monthly to collect their medication, and also to support some of like pocket expenses. Last but not least is infrastructure development. Maybe John have witnessed this. There are a lot of things that we built in the hospital, and also we renovate a lot of the old structures within the hospital. We are also technical assistant to the National TB program. So we are a part of midterm review, grant writing, strategic planning, guideline, and protocol development. So it is a holistic approach. Coming to Kono, we recently opened another MDR TB center. And the provision is the same as Laka. It's just the same. It's different site, but the provision is the same. So thank you. If you need to know, if you wanted to know more, some detail of our activities in PIH Sierra Leone, I'm here to respond to the question. Thank you.
Thank you, Dr. Jeroen. I do have one question. It's so shocking to me that a patient like Henry can go 2 years without getting correctly diagnosed with drug-resistant tuberculosis, and then be treated with drugs that aren't effective for all that time because of a lack of clarity in diagnostics. And that's really down to this $10 test, right? This $10 GeneXpert test being available to all people, because in 2 hours you could have known that Henry had MDR-TB. It's just that that GeneXpert test wasn't available. Is that correct?
Yes, in case of Henry was his treatment goes back to 2019. So at that time there was no diagnostic service everywhere in Sierra Leone. So these GeneXpert rapid molecular tests are being advocated recently. But a few years ago, it was like a luxury in most of the places in Sierra Leone, and you can't even find in most of the districts. So still, even though these GeneXpert machines are available in some of the districts, me as a TB doctor, I will not say that it is enough, and I will not say that again it is not all over the places. So we need more investments to make sure that these rapid diagnostic tests are near to the patients, so that we can detect more and more cases, especially for those that are remote to the capital city.
Thank you. I want to turn now to Henry Ryder, who, if you can unmute yourself, Henry, who is one of the people treated by Dr. Jeroen and cured of tuberculosis now and able to resume his life. Henry, I wonder if you can talk to us about your life before TB, your memories of your life before TB, what it was like to come to LACA, the hospital where Dr. Jerome treats folks, and what your life has been like since being cured. You're still muted. I don't know if there's an easy way to
Hello. Are you getting me
there
clearly
you
now?
are.
Hello, guys, everyone.
Yeah, we're getting you clearly. Hello, Henry.
I'm doing
Good,
great.
good
Hello
to
to my
see you.
doctor, Dr. Barry. How are you doing? Actually, according to doctor has already given us an update about me. It's really sad to remember my past. Yeah, all these things started when I was not thinking about this particular disease. Yes. Actually, it all started 2013 when I was not expecting this type of disease in my life, right? I usually go to school, play with friends, and even during that time, it was so nice. My friends love to play with me. Guys usually go out. They usually call me pastor, yes, because I usually focus in God's word and also teaching the word of God to my friends. So I was actually trying to sit my Beckel level in one of these secondary school in Freetown. When I started this Beckel, I got a good grade, wherein I started attending another school. So on 2015 to 2016 to 17, I started getting some signs and symptoms wherein my mom was thinking that it is about a particular sick that is not related to this one. But actually, this thing started 5 years ago. 5 years, when I was 5 years. Yes, I was on this treatment wherein I take the treatment, everything okay. So it all started again when I discovered that I found myself in the Laka hospital. During 2017, when we are trying to sit our examination in school, I was in SS2 by that time. I was in SS2 figuring out how to study so that I will be able to come out to flying course. So during that week, preparing for my examination, I became weak, tired, not able to study, and even strange things started. My finger, my thumb, swell up, wherein it was classed as a finger wiggler. So I was on that crucial pain wherein I was unable to start the exam. So when the finger eventually disappear, it come normal, I start my exam. On 5 weeks later, the team started again, don't have appetite, weak. I usually cough faster than before. I could not have properly sleep. Yes. So my mom worried, thinking, what is wrong with my son? So one of my mom friend advised my mom to take me to the hospital, wherein my mom agreed. They take me to the Connaught Hospital. By then, there was no hope because I don't be the individual that I would love to be, because I don't even eat, appetite lost. So my mom was so sad, anxious to know what is the cause of the problem. So I start outpatient process wherein I take there 7 months without no solution. From there, the Connaught individuals, doctors, the nurses decided to transfer me to one of the great hospitals wherein it is beyond Mambo areas. So when my mom heard the sound Mambo Laka, so my mom becomes scared. thinking that, oh, I will not see my son anymore. So gradually the nurse tried to build hope to my mom and also me. My mom don't even have sleep nights. It's really competitive, right? So she don't know what to do on that period. So they find a particular date wherein I will travel or move to the local hospital. I can remember during that process, my mom slept with me on the ward wherein my mom was so sad, crying all night. So when the vehicle or the ambulance come for me to take me, yes, my father actually reports my mom that if anything hurts me, my mom would be responsible for that. It was not easy. So my mom take the risks in signing papers, documents with the police, and from there, I was not the only one taken to the hospital. I was taken with one of my friends who actually passed away. Yes, he actually passed away. So we arrived in the hospital at around 5 a.m. Yeah, 5 p.m. 5 p.m. Can you recall? So eventually we arrive. The nurses attend to us, find a particular place for us to stay, and ask my mom to come and visit gradually. So I started crying. So, oh, this is the end of my life. I was distressed. I was not thinking that I will survive. Yes, my mom too, because when you hear about this particular place, people tell dangerous story about this particular place, saying automatically you arrive there will be no hope for you. Yeah. So when we arrive, 1 week later, Dr. Michael, thanks to Dr. Michael attend to me, asked my mom to find a place where he can get a blood, to donate a blood, because I've already lost blood, short of blood. So my mom was on that process, finding blood. Health and Sculpture don't have particular money to buy or to get a blood from a bank, because they said that if you want to get a blood, you should the individual should do a blood test to know the particular group where the individual is. So my mom tried to pay some bill to do some tests to know the blood group, and eventually I know that my blood group is group O. Yes. So on that process, PIH stepping, wherein they support my mom to get the blood, and I can recall during that period, it's around 7 to 8 wherein the blood arrived. Automatically, one of the nurse known as Nurse Madana was present. So eventually hang the blood on me until 9 p.m. My mom don't go nowhere, because my mom was thinking that, oh, this is a crucial period, I should not leave my son. So he sits by my side until the blood reached a particular level wherein I started having convulsion, like trembling on the bed, like this. So my mom was crying deeply. So Dr. Michael Rush, so what's wrong? Then Dr. Michael talked to my mom, tried to console her that it's just a process. So she does not need to be worried too much, because it will be all right. So after 9:55, the blood finished, and I was able to eat food, because I don't have the appetite to eat food. So my mom food that she prepared, I don't even have the appetite to consume it. So Nurse Madana was with my mom, so they advised my mom to find a pap, which is kuka oats. I don't know if you guys know about that pap, kuka oats. So prepare the kuka oats and it take a time to feed me until I reach certain level of the food. I said I don't want to eat anymore. So my mom started crying until Nurse Madonna advised my mom to go home and visit later in the morning. So my mom took the advice and went home. So in the next morning, Dr. Meg, because every day the doctor in Laka Hospital usually visits every patient admitted in the hospital. So every 9 o'clock we are expecting doctors to visit us. So I was actually staying with one of my companion patients, which is eventually rest in peace. Yes, he passed away. So I'm staying because that person actually, my neighbor who was in close with me was actually have no individual or family to visit him in the hospital. He was the only one in the hospital, no food to eat, no clothes, and there will be no individual that will visit this person. So when my mom,
Oh, Henry, you're starting to break up a little bit.
we usually share
Henry,
it
can I
to each other, make fun together, concern ourselves. Sometimes mom will come and my mom will have little bit of courage because she can see I'm interacting with my colleagues. I'm not crying. That give her the hope, and she can talk to me to take courage and also put God first. So she really is a very nice mom. She usually went home at around 5
can you hear me?
p.m. every day. She usually sell his item to find a particular source wherein he can make a food for me. Yes. So
Can you hear
at
me?
that period, on that
I don't think
period,
you can.
my father was not expecting me that I can survive. Yes. So it just take a month wherein my father starts visiting me in the hospital every week. I can recall the days, Wednesdays and Fridays. Yes, on Wednesday, he can come and leave some money, which is 25,000, sometimes 50, so that I will buy something that I need. Because as a sick individual, you cannot have a particular food that you will choose to eat. So time go on when individuals are already getting fit, because in the hospital they count on your performance. We usually
Okay, so we had to mute Henry for a second because he can't hear us. I don't know, Henry, if you can, I don't know if you can hear me at all, but if you can, I'm wondering, we only have a few minutes left, so I wonder if you can skip ahead to after you receive treatment, and what your life is like now. Because now he is a college student. After being treated by Dr. Jeroum, he became a college student. He is now in college. He's about to start his second semester of school. He's studying human resources management and accounting. It's really, Henry and I are friends, so I get to see his grades. He sends me his grades, and he is getting great grades and doing a great job at university. And it's really extraordinary what he's accomplished in the years since he finally was able to receive appropriate treatment and be cured of TB. So Henry thank you for sharing your story. I'm sorry to have to cut you off. I could know we only have a bit just at the end. Can we unmute him for a second? Go ahead, Henry.
Hello.
Go ahead. We can hear you, Henry. Go ahead.
Hello.
Oh, maybe he can't hear us. Let's go ahead and skip to questions, I guess, for a minute. Because I'm not sure that Henry can hear us, or he might be on a delay. The internet hasn't been so good in Sierra Leone the last couple of days. But I do want to ask a couple of questions that we've gotten from the chat and from other folks as well. Starting with a question that I think is probably for KJ and myself. From Sarah Balick, what role does PIH envision groups such as TB fighters to play in future campaigns? So our community who watches the videos that my brother and I make and watches Henry's videos and lots of other people. By the way, Henry has a great YouTube channel if you're interested in following him. There's a group of people who've emerged out of that community called TB fighters, who have pressured companies like Danaher and Cepheid to lower the prices of TB diagnostics, pressured Johnson & Johnson to open up availability to their drugs. And I wonder what role, as both of these movements mature, KJ, what role you see us, our community playing in that?
Well, I think it's also related to a question that's in the chat too, about patients. When we talk about civil society, we're thinking of communities of citizens, right? So we're not talking about doctors or nurses or healthcare workers. And one of the most powerful types of groups are patient groups, or you might call them TB survivor groups. And in the HIV community, patient groups or people living with HIV have been incredibly powerful. They have, in the US too, in the beginning of the HIV/AIDS epidemic, they changed US policy. They gave feedback on clinical trials. In South Africa, they have been very, very powerful in changing national policy. They haven't been as powerful in the TB world. And I think that's part of the stigma and discrimination that TB survivors feel even after they've been cured. They just don't want to be associated with that disease anymore. They just want to get on with their lives. But I do know that this is a potentially really powerful advocacy group. When I was in Peru, they used to tell me stories about how the TB survivors would get together and they would go to these congressional meetings and just stare at the politicians, and at strategic moments they would cough really loudly, and they got changes in their TB policy in their ministries of health. I feel that PIH definitely needs to work more closely with TB survivors in all of our sites. And I would hope that TB fighters also learns also from these TB survivor groups too. TB fighters is just shown to be powerful. In the campaigns that you've done, it's been remarkable. So I just hope that certainly PIH has a lot to learn from TB fighters, but I'm sure also the TB fighters are just starting to scratch that surface of what that potential advocacy power. And I think that trying to build linkages with TB survivor groups, across the world, maybe ones that are working directly with PIH healthcare workers, that could be really interesting, really important learning experience, and could really inform that advocacy going forward.
I think that's great advice, to find ways to collaborate better and more deeply with TB survivors. like Henry, other activists and advocates. I think that's really important. We have another question about COVID-19. What is the COVID-19 pandemic meant for progress in the fight against TB from maybe Dr. Jerome?
Ebola, like when Ebola struck Sierra Leone, it was actually after Ebola that we saw the rise of MDR TB, because during Ebola, facilities were closed, patients don't have access to TB drugs and whatever. And it's the same thing also during COVID. People are scared of going to the facilities, accessing facilities. So you expect that dynamics to create a situation where people don't have access to drugs, to treatment, and can lead to a lot of unintended consequences. So it has an impact in the TB response, because during COVID, we even know, Dr. Jerome, we have to set up an emergency unit for COVID. We have to set up a COVID treatment unit within LACA, because patient will come, you're not sure when you have a lower immunity, and so it's all those dynamics can create. Dr. Jerome to step in.
Yeah, I think Dr. Byron has said most of it, but I wanted to add 2 points. One is what I say is there is a diversion of attention, especially from the government response on COVID, and the TB is a kind of forgotten for a while. So everyone is embarking on COVID, and it was difficult to cascade training to focus on case detection and the treatment and all that stuff. So it has an impact in diverting attention from TB, HIV, and the other diseases to COVID, and also it majorly disrupted the supply chain. That was one of the biggest challenges we found. It was not easy because of the curfews, because of the logistic problem we have. There were a lot of stockouts, and even when you have a drug, it is difficult to take it to the peripheral units, to the district, to the provinces. So it has a great impact in disrupting the supply chain of diagnostic tools and also treatment drugs as well. So we start seeing after the COVID is coming down, we start to see the impact, because those sensitive TB patients that were not really treated well during the COVID time, they are coming as an MDR TB patient. So there is an influx of MDR TB cases just post-COVID, and we just consider that as an impact of COVID-19 on the treatment of the sensitive tuberculosis. Yeah.
So we see more drug-resistant tuberculosis after COVID, just as we did after Ebola, because people are unable to access the healthcare system. They're unable to follow through with their treatment, and they may not be able to get access to appropriate drugs, and so they end up with drug-resistant tuberculosis, which is another way of understanding how profoundly TB treatment and the future of TB is wrapped up in the strength of our healthcare systems and our ability to deliver care to everybody within those systems. I look at and we have to wrap up here, but I look at the life of somebody like Henry, and if it weren't for the intervention of PIH, as you said, Dr. Jerome, Henry might not be with us. He might not be in college. He might not be achieving all that he's achieving, helping bring awareness to this important disease, also advocating for other people in his community. The work that he's doing is extraordinary. And it's like you said earlier, Dr. Jerome, there are so many Henrys who are not receiving appropriate care. And we know that they can. So that's one of the reasons why it's so important to support Partners in Health during this Giving Tuesday. I'll say it one more time. If you are in the US, your gifts are matched 3 times. If you're in Canada, you can donate via PIH Canada. I'm just so grateful to be able to be here with y'all today. You know, it wasn't too long ago that I was at a Giving Tuesday webinar with Paul Farmer. This is the last time I talked to Paul, and I feel his presence every day, but I especially feel his presence in the work that all of you are doing, because tuberculosis was such an infuriating example to Paul, as it is to all of us, of how injustice and impoverishment are the root causes of so much of the healthcare inequity in the world. And in many ways, tuberculosis is an expression of injustice in our contemporary world. It's an expression of what's wrong, but it can also be an expression of what's right. And just as there are so many vicious cycles with TB that we see all the time, where you know, acute on chronic healthcare impoverishment leads to higher rates of TB, there can also be virtuous cycles. Every time we stop a TB infection or cure a TB infection or prevent a TB infection, we're potentially ending one line of further TB infections. And I'm just reminded of those virtuous cycles talking with you here today. And I'm just so grateful for all of y'all's work and for everybody who's part of it. So thank you very much. Thank you, Henry, for providing the experience of what it's like to live with tuberculosis and be treated for tuberculosis. Thank you especially to Henry's mom. Henry wrote a poem recently that's so beautiful, and I just want to read you one line of it. He said of his mother, "You stand closer when everyone runs away." And to have a mother who stands closer when others would run away is a great gift, but it's also a reminder of what Partners in Health is trying to do, to stand closer when others would run away, is what Dr. Jeroen is doing. It's what Dr. Sung is doing. It's what Dr. Barry is doing. So thank you to all of our panelists today, and thanks for being here with us. It's just a joy to be with you. So thank you, and the work goes on.